this work right here. So carpal tunnel, the superior portion of that's right there. So, and then it's not very thick at all here, and then through that, it's only about 17 millimeters or 3/4 of an inch. So in that area there, like I said, there are 10 structures. The 9 tendons that come through here, 4 here, 4 here, one at the tip of the thumb, and that nerve is nestled right in through here and branches off into the hand. It breaks off here. So then it breaks in again from here into your interossei, your lumbricals are on top here, your profundus, your superficialis, and then they go up into your finger flexors.
Yeah.
So it's really this part of the hand. It's all quite amazing, but there's 18 muscles alone just in through here.
Wow.
Yeah.
How long have you been doing hand therapy type stuff?
I've been in clinical practice for 29 years now.
Okay.
So, but I worked in brain injury rehab, multiple trauma, and worked in some of these things, but I didn't specialize until a couple of years later. So about 27 years total right now.
Where'd you get your degrees?
I got my, it was my bachelor's at the time, so I didn't have masters and stuff like that.
Okay.
At Cuca College, and then became a certified hand therapist in 2001, but I had been in practice a lot longer than that beforehand. A strength and conditioning specialist, you know, I got that through the NSCA. That was early on because I often thought about getting out of therapy and getting into strength and conditioning. Had an opportunity to go for an interview down at Penn State and didn't take it.
Okay.
So that was a long time ago. So that was always my first love, working with competitive athletes like yourself. So.
What teams? Do you know what teams you were interviewing for to work with?
It was so I had a contact through Penn State through one of the local schools I was at, and they was just going to look at working in the gym, like for probably whatever team it was going to. I don't know. It was like strength and conditioning coach. So they said that there were 2 certifications they wanted at the time. One was the NSCA's CSCS certification, and the other one was the American College of Sports Medicine's.
ACSM.
Yeah. So those are the 2 at the time, and so that was probably 27 years ago. I got those, and then decided I'd stay with the therapy route, and then naturally moved in because I love training and stuff like that, and working with these types of conditions. We moved generally to the hand therapy, and that's a certification through the Hand Therapy Certification Commission, and you have to minimum of 5 years experience, and then you have to maintain a continuing education credits every 5 years. So.
Do strength do strength clinics and things like that count for your CEUs?
So that's a good question. The NSCA is a little more picky now. Not all of them do carry over. Some of them do. They want more. So I have to take more exercise-based.
You should come down to Juniata with me.
I'd love to do that, man.
I never think about it.
I usually think about it after you say something about it, after you post it.
I don't even really think about that clinic enough anymore because it's always so close to nationals, and I'm like so focused on nationals. It's usually like within a week. So like even this year, I didn't even really know what I was going to present on until after nationals. You know what I mean? And then it came together. I put them. It was a hands-on session, so I put them through some good stuff. But, they switched it. It's not at Juniata anymore. It was at. I want to say it was called Mulhern University or something like that. I can give you the name.
Yeah.
I've forgotten it now, but it's Darren Thomas.
I'd love to go.
Yeah.
There was a Ithaca College had a NSCA one-day seminar, but I didn't get to that either this year. But I would love to go down there and check that out. Yeah,
it's a really, so they always have 2 tracks going. So there's 2 rooms with speakers in it. And you can go to the one that fits your profession the best. So like if there's somebody talking about squat and then someone else talking about shoulder rehab, like if the squat isn't what you're interested in, more of a shoulder rehab, you can go up to that one.
Oh, really?
And they run it exactly the same time.
That sounds really good.
Yeah, so they're usually pretty. You're not going to see like bench press in one room and squat in the other room.
Right.
You're going to see 2 totally different things. Yeah. You know, it's coordinated pretty well.
Sounds great.
I've gone. I think I went my first year in 2001.
Yeah, you've been there,
twice.
yeah. And you presented a couple times?
I present almost every year.
Oh, nice.
Yeah. I've done a few talks, probably 5 talks,
That's great.
and probably 12, at least 7 to 10 hands-on sessions.
I think as far as your experience and your knowledge base and stuff that comes, you can only be a better competitive athlete with understanding the anatomy and stuff like that. You know what I mean? And then teaching it, when you teach it, what I've found is if you teach it, you better know it. So you know it because you know you're out there teaching your colleagues and stuff like that, and it really helps you grow a whole lot more.
Yeah, it makes you more accountable to have the best information. Yeah.
So what I'm going to do now, we're going to do kind of some pin and stretch a little bit.
Okay.
So I'm going to have, if you don't mind me doing me a favor,
You just tell me what to do and I'll do it.
I'm going to have you take a vid while you're doing that, if you don't mind. If you can find that on there. I'm going to get to it okay. Let's see, I'll hold it down just for a second.
Face ID, whoops.
Let's see. It's a pain, man. Just hold it down for a second. It's like, does it work? Oh, okay. Yeah, there you go.
Okay.
And then it's right down there, yeah.
Yep.
So I'm going to pin and stretch this. So I'm going to have you
Pin and stretch.
Yeah, pin and stretch. You're going to bend that finger for me. As far as you can get that down, yeah. And I'm going to pin that down. Now straighten that back up for me. Back down, pin it, and then back up, straighten up. There you go. Pin it. Yep. Up again for me. Good. Pin it. Up again for me.
That's kind of how I've been doing those.
Up again for me. Pin it.
Whatever that last stretch you had me do.
Yeah, the intrinsic stretch.
The fisting.
Oh, yeah, good.
Yeah. I've been like pinning it and then stretching against the resistance.
And then relax. Good. All right.
That's great. Yeah, that felt good.
Very good there. So let's hold that down one more time. So now I'm using my fingers. Now straighten it up for me. Back up. Back up. Back up. Back up. Down again. Good. Okay. Go back into that stretch now. Elbow on the table for me. There. Bring that down. And relax. Yeah, that wants to flex a little better. Yeah, that's better, Jed. That's good. Oops, sorry. Where'd you feel that at? Here in the joint. In the joint. Okay, that's it. Yeah, it wants to come down. Okay. Back up again for me. All right. Let's pull that back. There you go. Just bend that for me a couple times. It's gonna be 10 or 15. Good. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. All right. Take a breather for a second. And then what we'll do is to show. All right.
Yeah.
All right. We'll do it.
Yep.
So let's do this again. Spread those fingers apart for me a couple times. Really good. Yep. And what we're going to do next after this is I'm going to kind of move up the finger a little bit here into this area and then have you do some blocking there, and then I'm going to clean that off. I might hit you with a lymph touch just a little bit, see if we can open that up. I'll probably needle, and then I'll needle it right afterwards again. Let's see what we got. So.